Now, big or small, visible or hard to spot, most of us have a scar of some sort. Now, they inevitably carry a story, some with pride, but some are more psychologically damaging than others, and they can have quite a profound effect on our self-confidence. We have consultant dermatologist Dr. Rosemary Coleman. She's back with us this week to tell us about some of the methods of concealing scars and other skin blemishes. Lovely to have you back in.
Thank you.
Do people in your surgery, in your dermatological surgery, do people come in specifically with scars that they want to get rid of or hide? Or
Yes, they do.
They do?
They do.
So it's very common to want to get rid of them?
It is. It's very common to want to find out exactly can you do anything about it. But they certainly come in for discussion and decide whether or not that treatment is for them, if we can help.
Yeah.
The problem is we can't help all scars, so the most important thing is to try and prevent the ones we can prevent.
Now, you came in the other week and you were talking, and it was a brilliant discussion about acne.
Yes.
And we saw some of the scars that are caused by acne. This is even post, even when the acne itself has gone away. We have a few photographs here. Would this be one of the most common complaints people have?
Acne would be one of the most common causes of medical scarring.
Right.
And the trouble is that while the scarring may not be very obvious while they're a teenager or while there are lots of spots and there's a lot of inflammation going on, what I find is that a lot of people, when they start to hit their 30s, 40s and 50s, find that the natural loss of collagen and loss of elasticity in the skin actually makes their acne scarring look worse as they age.
Wow.
Which is...
So it even after the acne or the psychological trauma of the acne goes away?
Yeah. As the skin loses elasticity, the scarring can become more obvious.
Treatment for it then, is it possible? Can you get rid of scarring from acne?
You usually can't get rid of it, Shana, but you can often reduce it by 60 to 80%, and that's often much better than your original problem. So the important thing is, as we said before, treat acne early, treat it aggressively, prevent what you can. If you see a sign of scar, treat it very fast. And with regards to the scarring, the improvements can be made with a combination of laser or fillers. So if there's a lot of depressed scars on the skin, if there's a lot of depression, we can pop in a little filler with a small injection underneath it to make the surface flat again.
Okay.
Or if the scars are very red, we can use laser to take out the redness, or use another laser again to even out the surface of the skin and tighten it up again.
So I think we've a photograph of before and after, and I think, is this, you can explain to me, is this laser surgery you were saying? I don't think we have the pictures coming up at the moment, but you were saying the skin fillers is like a collagen injection going in, the laser, and it works. Is it worth doing, is the bottom line? Is it worth going
it's
to somebody?
Certainly worth getting assessed. We don't really use collagen much anymore because it causes a lot of allergies. It's from cows, and 1 in 5 people will have an allergic reaction, and people need a test patch every time they need it, so that's really very cumbersome. We have a very good substitute. Hyaluronic acid would be the generic name for one filler, and Sculptra is another one, which is used to recreate the volume.
Right.
So for the depressed scars, that's what we do. For the raised scars, we do the opposite. We try to thin them out with steroids. So if somebody's left with lumps and bumps on their skin, red lumps, we inject steroids or use steroid-impregnated tape to flatten them.
Okay.
So a lot of people worry with steroids about the side effect. Everybody says, oh, they'll thin your skin.
Yes.
Well, this is one situation where we want them to thin the skin. We use them for that side effect.
So it's actually working the way.
Yes.
And scarring like this, say acne scars or anything else, is it considered cosmetic trying to get rid of them, or can you get it on a medical card? Can you get it on insurance, or is it...
It's a contentious area. I don't consider it cosmetic in any way. Scarring can have, as you mentioned, catastrophic effects on your confidence, particularly acne scarring on your cheeks.
Yeah.
And by and large, it's certainly tax deductible. If the lasers are available in your area, you'll certainly get it on the medical card. Okay. And some insurance companies will be more forthcoming about reimbursing than others.
But do look into it. The surgical scarring is the other area. So somebody has an accident or something, and they had a baby and they had a cesarean section. Again, can cause a bit of trauma depending on where the scar is. How do you treat that?
Well, a lumpy cesarean scar, first of all, it can often be itchy, so that's why people will often come. It's often raised and it's often red, so we'll laser it to take out the redness, and I'll either inject tiny dots of steroid to flatten it or use a steroid-impregnated tape. This scar on this arm followed excision of a lesion like a mole, and the scar became spread and red and unsightly. And I think there's an after shot there showing that after just a little intense pulse light therapy, that scar is almost invisible. The patient's much happier with it.
And pulse light therapy, what does that do?
It takes out the redness.
That's the one that
shuts down the blood vessels.
Okay. So it's actually amazing seeing that. I want to go back, if we have, can we go back and look at the before and after acne shot? Because I just want to see, because you were saying it does work, and I'd love to actually see it in person, if we can do that.
It does work. You can usually improve scarring.
Now, see there on the left, there she has acne, and look at the after. Because this is just what we really want to know. Is it possible? Because people live with this for years.
Definitely. Well, she's a lot of red scars. They're depressed and they're raised there. She would have had a fractionated resurfacing with a system like a Fraxel. And that system would require a few treatments, maybe between 3 and 6. Very little downtime. She'd be red and puffy for a few days. But over the period, and this shoulder was the same, this would be a fractionated resurfacing system like Fraxel or Starlux. And you can see these depressions, you grow collagen. What happens is the laser burns tiny holes in the skin and fresh collagen grows up through the holes.
It's incredible.
It's wonderful.
That is incredible to see it. Now, other scars that you mentioned to me earlier, say abnormal scars. So again, if you, I don't understand, if you have a scar from something, an accident, it can grow abnormally. Can you explain what those scars are? Because people at home might, there's one, people at home might recognise it on themselves.
Okay. Well, this scar is predominantly what we call hypertrophic, meaning it would have started off, this person, I think it was an acne lesion, and then it becomes keloid, where you can see these little finger-like projections at the side where it's not just growing in a straight line, it's growing out beyond the boundary of the original scar. So we call that keloid, and it's very heaped up and thickened. Now, these scars tend to be very red, and this was on the centre of a young girl's chest, right in the middle of her sternum. And you can see on the right, she's very happy now because with intense pulse light therapy and steroid injections, and we also gave her some steroid impregnated tape to use at home, it's almost invisible.
That's incredible. How long would that take?
I was about to say, that can take a while. She probably had 10 to 12 treatments to get there.
Really?
Yeah.
And again, the cost of these for everybody is it expensive?
For something like that, no.
No. And what about when people have an accident or a general accident, is it the same procedure? If you have a car accident or you had an accident where you have a scar, you had a scar from childhood, it was never stitched, so it wasn't surgery, can you do the same sort of thing? Can you go and get that treated if it's just annoying?
Yes, you can. It depends on what's wrong. If it's a scar from childhood, often the redness will be gone. It will often be white, but if it's raised, we can thin it out. But if it's white and flat and spread out, you may not be able to help. A lot of lasers are working on that at the moment, the same lasers that are working on stretch marks. The idea is, can we stimulate pigment back into certain scars, and can we improve the collagen in the thin fibrous tissue? That's coming. I think that's only a matter of time. It's on the way.
So the answer is, this will be able to happen.
I think so.
That's incredible. And I want to go into, you've brought some amazing camouflage products here. These are if you just want to cover it up, if you're not going for surgery. Can all these, I don't know if you can see them here, can they be bought just in the supermarket? They're not
They're all bought in the chemist. They're just basically a variety of different camouflage agents for either scars or birthmarks anywhere on the body. Sometimes they may not bother people on a day-to-day basis, but for a special occasion they might put, the camouflage on their hand or whatever, but on a day-to-day basis that can be quite cumbersome. And
you mentioned the birthmarks there. You're talking like port wine stains,
yes. Or white conditions like vitiligo can be used. You can use camouflage to cover up white marks or red marks.
I want to look at one here. They're quite. Are they heavier than normal makeup?
Much heavier. And they're denser. They'll have optical enhancers and they'll reflect light. They'll be quite a different texture.
Oh, okay. This here is like concealer.
More like stage makeup, isn't it? And more like concealer. That's exactly right.
And so I mean, do people tend to wear these? Are they good things as far as you're concerned?
If you've got a big red mark on one side of your face, you'll look better camouflaged for a special occasion if you're conscious of the mark. So they don't mind the fact that the makeup looks a little heavier. I'm looking at this fine film corrective makeup.
Can you see this here? I just want to. There's something about courses that you can do in corrective makeup with the Red Cross or...
Yes, the Red Cross have always been very good at camouflage. La Roche-Posay, the company who makes that particular range, ran a series of workshops a few years ago. I don't know if they'll be doing it again, but they ran workshops through dermatology clinics to help people camouflage and to teach them tips.
Yes, yeah. Well, that's good. We'll put those details on the website. But it is quite thick. It's interesting. It's actually, I have a tiny little... beauty spot there, and it's actually nearly covering it up. It's perfect.
It is.
Well, listen, thank you. Do you know what the great message that's coming out of everything you're saying is it's possible? I'd say there's so many people at home that may have scars that have never sought treatment for them, never knew it was possible to get rid of them or make them look better. So that's...
We usually can.
Good. That's good to find out. We'll have all the details and everything we've talked about on the website, as always, so that you can check if you have a particular scar, you can check on for your particular one, and we'll have it on air till page 365. Thanks for that.